And in fact, we wrote a paper about it that we're working on getting published right now. And I hope you agree. And I want to turn this over to Dave because he has some last words that are important.
I've got to say, after I got better, I started a blog. I didn't know what I was going to do with it, but I called it The New Life of Patient Dave. It's astoundingly, I'd already been participating in the blogosphere under the nickname Patient Dave, and I started that blog in November, and then in January, Denny told me about the ePatients Working Group, and I got involved with them. And I immediately renamed myself ePatient Dave. The thing that the treatment actually ended on July 23rd of 2007. It's astounding how potent this stuff was. I went from almost dead to just like all better in 6 months from initial diagnosis. But I still vividly recall, the day that we got the actual diagnosis. I went to bed at 11:30. I woke up at 1 in the morning, and I was just like bolt awake. I had this image of the look on my mother's face at my funeral, and I felt like this is it. Like the book of Dave's life is closing down. There's no more what does he do in retirement? What's his daughter's wedding like? And I went through that shock, and we got used to it. And I face that question, what do I do to improve my odds? My ability to do all these things, I have no doubt, improved the strength of my own immune system. There are people who say that there's some evidence that the immune system functions better when there's a sense of hope, and empowerment. Our experience was completely transformed by all these uses of technology. And so once I learned about this group, I decided what I'm going to do now. This isn't my day job, but I'm going to do everything I can to spread the word as far and wide as we can.
And we knew we came full circle when one day I got a message on Patient Site from Dave that started out, now about that shoulder. Well, that's all for our formal presentation. We want to entertain a few questions, and I just want to thank Dave for doing this with us.
Just a lot of time.
Thanks. Questions? Yes.
I don't have a question. I just have to say you're so remarkable and so courageous, and I applaud you for being here. This is wonderful.
Thank you.
In the back, Matthew Holt. Oh, no, sorry. You got microphones. Excellent.
I have a couple of things. One, I just want to offer a friendly amendment. An editorial that I actually gave earlier yesterday to Susanna. I'd like to suggest that we say it's participatory e-health and not e-medicine. Partly I'm a nurse, and I would like to say that there's lots of other people in medical. So I'd like to offer make it e-health, participatory health. The other thing one of the things that struck me about this and how wonderful it is the incredible interchange that went on between you and Dave, that it was really a collaborative effort between both of you. And I've been struck as I've been walking around and looking at the different vendors and all the incredible tools that are being created to, capture the data about what's going on for patients, monitoring vital signs and strength and weight and BMIs and so on and so forth. But not all of them are doing it so that the information goes back to the patient as well, so the patient can participate in it. It tends still to be directing it the old way that we used to do healthcare, that all of the monitoring, the data goes to the provider, and then the provider has the responsibility to go back. So I'm wondering if you can talk a little bit about how to do that, change the vendors also to realizing the incredible lessons that you've learned about that, the importance of the collaboration that you guys developed.
So that's a really tough question, which is that, how do you change the whole mindset? I think in some ways, and this just to be very practical, I mean, what you're talking about is very important, is, how do you let all the patients have access to their information? I was involved in a project of data sharing in the state of Massachusetts. And the question was, what we were trying to do is deliver medication histories to people, to doctors and nurses at the point of care, which is great, right? But nothing in the project let patients necessarily see their information. And part of that is really a practical issue, which is that there are so many people out there, and you've got to then manage all their password access and so on. So that's a really simple answer to sort of the complexity of the problem. But I totally agree that there's actually a cultural shift that needs to take place, which is that they got to be asking the questions, is there a way we can do this? And I don't know. I mean, certainly at Beth Israel Deaconess, we've embraced this. At Partners, they've embraced this. A lot of places they have embraced it, but it's not pervasive at all yet.
And frankly, this is not at all complex to me from a business perspective, because what you do is you beat on the vendors and refuse to buy from people who don't provide that. Now, there is a massive safety argument here, a case to be made in terms of safety and avoiding adverse events. Last March, a year to the week after my kidney was removed, there was an incident in Minnesota where a patient with kidney cancer in one kidney had the wrong kidney removed, the healthy kidney removed. What happened in that case was their patient portal provides access to some radiology reports, but not the CAT scan that identified the wrong side. If that had been visible, like me being identified as a 53-year-old woman, right? And the family might have looked at it and said, what is this? How could you, blah, 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 but that would have been the end of it. Now, if we can just, as a safety move, open up that, just let the public, the family, the community be proofreaders, and that'll especially be powerful now that we're in the age where the payers are not going to reimburse for the consequences of adverse events.
Other questions? Oh, in the back?
I'm Jamie Haywood from Patients Like Me.
How you doing?
That was an incredible story, and one that I've heard with actually, unfortunately, a less positive outcome in the end, but from many people that have gone through that journey. I wanted to recast the power dynamic a little bit and maybe focus a little bit more on when the value creation went here, because obviously, again, this is a converted audience, but let's think about where the value was generated in this transaction and think about whether, as a medical system, it was part of generating that value at all, or in fact is congratulating itself for stepping back from obstructing the generation of value to be less obstructionist. And even the example you just gave about the kidney from the Midwest came through your personal connection, not through any real information network. It was a random and ad hoc. And and I think if you look at the cost, the infrastructure, the reimbursement, you have an amazing case that is inspirational, that may have particular phenotypes that relate to you, that could be useful or valuable, that could be shared with the world, that could advance that. You spent hundreds and hundreds of thousands of dollars in a medical information framework that will do nothing to make that useful information available to anyone else. And I'm being a little harsh, but I think that if you think about the value that I heard described, the experience, the side effects, the fundamental experience of being a patient, the healing aspects of the disease, using the power of the internet to extract information ahead of the formal system to make effective treatment decisions. I am exaggerating without question, but I think at some level, this is beautiful, but it is an indictment of just how far the process of practicing medicine has come from the fact that medicine itself is an information platform that it is not serving.
Well, sure. Yeah. I mean, where it was and where it's emerging from deserves to be indicted. Last night, Europe is 5 to 10 years ahead of us at doing connected health things. Last night, I spoke at a dinner from the people in Northern Ireland who are beginning to roll out connected health as the first country in Europe doing that. I absolutely agree. We're in the Stone Age. Look, in bill printing, once upon a time, 20, 30 years ago, a credit card company would put somebody else's charge on your card. Guys, they solved that. This is not rocket science. All we need to do is bring that technology in. I'd love to talk with you more, Jamie. I think that's a terrific...
I just want to make a response, and I'm not defensive about this because I think you're right in many ways. You're trying to be provocative, and I understand it.